It is noon. We are at the top of the hour and we have a lot to cover. So I think I'm feeling good to, pass it off to Adam and he can get us started with this conversation. Again, thanks so much for everybody for joining.
And yes, thank you so much. My name is Adam Germick. I'm the president and CEO for Special Olympics Tennessee. I just want to welcome you all to our first ever Health Summit. Really exciting day in Special Olympics Tennessee's history to have all of you with us for this historic event. And we're really thankful that you're here to be part of this summit. Just to start off, just a little housekeeping. Everyone should be muted now. So if you don't mind, remain muted. If you do have questions, feel free at the bottom of their screen. If you're on the computer, and if you don't, I think on the phone is 3 dots, there's a chat function. So if you click on that chat function, you can ask questions throughout, and we will be monitoring those throughout the summit. And hopefully we will get to your answer while we're going through. If not, we will address them at the end. We will be taking some photos throughout. So we will give you a heads up. So if you don't want to be in the photo or you do want to be on the photo, you can turn your camera on or off. We just wanted to make sure that you had that opportunity to do that. So we will let you know when we are taking those photos. But today we will be presenting the Tennessee Golisano Health Leadership Awards to 3 spectacular health partners. We'll kind of kick off the day with that. After that, awards will be followed up with our first ever Health Messenger panel. So you can see some of our panelists, they're in the green shirts, our Special Olympics athletes, and they're just wonderful, wonderful health leaders that will help discuss the significance of incorporating inclusive health in our communities. For those who don't know what inclusive health is, and who inclusive health means, with people with ID are able to take full advantage of the same health programs and services available to people without ID. So currently people with ID face significant obstacles in assessing quality healthcare that promote fitness and wellness, resulting in pronounced health disparities and reduced life expectancy. So what we're asking you all to do today is to join us in this work towards that inclusive health mission. And by participating in this summit, you're taking that first step. So we really appreciate it. But we all know and believe that if we come together as a community, we can make lasting changes to help our athletes become healthier, live healthier lives, and achieve their highest potential both on and off the fields and the courts. So, we couldn't be here today without some of our important supporters. So I want to recognize 2 of our wonderful health partners, LifePoint Health, who's doing so much in the healthy athlete space and supporting the health of our athletes, and United Healthcare. Thank you to both these organizations for allowing us to grow our role in making health a priority for all of our athletes. I would now like to introduce our Executive Vice President, Joanne Drumright, who will be presenting our Inclusive Health Leadership Awards. Thanks again for being here. We are excited about our first ever Health Summit. Take it away, Joe.
Thank you, Adam. Well, hold a second. There you go. Thank you, Adam. Today, I do have the honor of presenting our 2020-2021 Golisano Health Leadership Award to 3 exceptional Special Olympics Tennessee health partners. The Golisano Health Leadership Award recognizes health organizations and their outstanding efforts towards fulfilling the mission of Special Olympics Global Health Program. The award was created in September of 2016 to honor organizations that improve access to healthcare, fitness, and wellness programs for people with intellectual disabilities. This includes increasing essential healthcare, providing health for people with people with ID, and advancing the year-round work of Special Olympics. The Golisano Health Leadership Award is the very highest honor health partners can receive from Special Olympics. And I'm so excited to have these three honorees with us today. Over the years, they've worked with us and we've developed some very longstanding partnerships and friendships. So we're excited to present them to you today. But before we do that, I want to share a very special message from one of our health messengers, Will McMillan. So Will, Jordan, let's roll his video.
Hi, Jordan. I think that there's problems with the audio.
Can you not hear it? I can hear it on my end.
No, we cannot. So maybe stop sharing your screen and optimize it so that we're hearing the audio on everybody's end.
There's two little boxes at the bottom there, Jordan.
It's not Zoom. It's not Zoom without a little technical difficulty.
That's exactly right.
Here, let's see.
Health leader, I
Can you
want to
not
take
hear
the
us?
opportunity to congratulate LifePoint
We can
Health.
hear it now, but
We
can you
can
start it
hear
from
it
the
now.
beginning?
Yes.
Once again, Will McMillan.
Hi, my name is Will McMillan, and I am a health messenger with Special Olympics Tennessee. As an athlete health leader, I want to take the opportunity to congratulate LifePoint Health and the Vanderbilt Bill Wilkerson Center and the Tennessee Association of Optometric Physicians for winning Tennessee's 2020 and 2021 Golisano Health Leadership Award. The Golisano Award is the highest honor for health partners and individuals that Special Olympics awards. The amazing organization has done so much to bring Tennessee closer to inclusive health. I am so excited to celebrate their success with you. As always, stay safe and stay healthy.
Thank you, Will. Will is an amazing young man and one of our newest health messengers, and we appreciate the time and effort that he has put in to become one of our health messengers. So moving forward, if we can move, is this the next slide? There, next slide. There we go. For more than 20 years, the Tennessee Association of Optometric Physicians has provided free vision screenings, prescription eyeglasses, and sunglasses to Special Olympics athletes at each of our summer games. Over the years, I would estimate that close to 3,000 athletes have received free vision care through the work of the Tennessee Association of Optometric Physicians. A very special thank you goes to Gary Odom, Dr. Jeremy Diamond, and Leslie Moss for their ongoing, for organizing the earliest health events and providing resources to athletes. Congratulations to the Tennessee Association of Optometric Physicians. We look forward to the next in-person vision screening. Our next awardee goes to Vanderbilt Medical Center, Bill Wilkerson Center. And for many years, Dr. Hillary Davis and Dr. Rachel Hughes from the Vanderbilt University Medical Center at Bill Wilkerson led a team and organized biannual healthy hearing screenings where athletes, unified partners, coaches were given free audiology screenings. Teams of volunteer audiology students, audiologists from Vanderbilt, ETSU, and UTK have administered the free health screenings. These screenings occurred in conjunction with our state basketball event in Nashville and the state's winter games in Ober-Gatlinburg. Dr. Brittany Day and Dr. Caitlin Riley took over the leadership of the Special Olympics Healthy Hearing Screenings, and several years ago, under the direction of Dr. Day's leadership, the hearing screenings have increased in participation. Our hopes are to include an ENT component to future screenings. Congratulations, Dr. Day and the Bill Wilkerson Center. Our newest health partner, LifePoint Health, has provided Special Olympics Tennessee the ability to host additional health screenings impacting nearly 4,000 athletes. The partnership will provide opportunities to reach further into communities by hosting health screening events in areas away from our state competitions. Their partnership has provided funding to equip local programs with PPE equipment for 10,000 athletes and fitness equipment to over 1,000 athletes, helping them to stay fit and healthy during this pandemic. Looking to the future, LifePoint Health's partnership will provide facility use and staffing for health screenings when we return to in-person screenings. David Dill, the CEO of LifePoint Health, Dr. Chris Frost, and Dr. Chris Frost is the National Medical Director of LifePoint, and the LifePoint Health Social Responsibility Team are creating ways for all of us to help bridge the gap in healthcare for Special Olympics athletes and the ID population. A very, very, very huge congratulations to LifePoint Health. Thank you again to all three of these amazing organizations for their unwavering efforts in making Tennessee's communities a safer and healthier place to be. I did want to share one last announcement before we move on to our Health Messenger panel. I want to inform summit participants that the Vanderbilt Kennedy Center is running a survey to get your insight about the best way to connect people with disabilities to resources and information. Survey participants will be entered into a prize drawing, so keep a lookout for the survey link that will be distributed after this summit. And with that, I think we are ready to hear from our amazing health messengers. They're sporting their new Health Messenger polo shirts, and they're all spiffed up to give their presentation. I'll have our panel moderator, Alicia, take it over from here.
Yes, Joe. I think we're all ready to hear from the athlete health messengers. I know I am. Thanks, Joe and Adam, so much for kind of, kicking off this event. I am Aisha Iger. I do the health management at Special Olympics Tennessee, and I'm delighted to serve as the moderator for today's event. I cannot overstate how inspiring and amazing these athlete health leaders are. All health messengers have gone through an intensive training on a variety of different health topics, so they're absolutely qualified to serve as health advocates, role models, educators across our communities, and they have generously offered their time to spend and share with us today. So I think we need to move towards getting everybody oriented and aware of who's who and all the faces you'll be seeing today. So on the panel, the faces you'll be seeing speaking is going to be Eric Massey, Alex Hanna, Haley Romines, and Sarah Bollinger. They are joined today by their health messenger mentors. So they might be popping in and sharing their 2 cents as well. And actually, I think that, something I'd like to mention is 3 out of the 4 messengers are from Memphis. So we got a lot of representation coming in from the west of the state. So thanks you guys for joining in on this cold day. All right, so I think before we actually start with the panel questions, if we can move on to the next slide and get everybody oriented to inclusive health. I know Adam kind of gave us a taste about what the definition is, but I think it's really important for us to, really get that foundation and understand what we're really talking about. So inclusive health, what are we trying to do here? I know that Special Olympics is actually, first and foremost known for its sport. And in fact, I think our hearts and our souls are out there on the field, even when we are being socially distanced and we're, kind of cooped up inside, especially because of the weather. But it's important to know that Special Olympics is not only a sports organization, it's also a health leader for people with intellectual disability. And it's really important to know that we're working our hardest to ensure the inclusion of people with intellectual disability in mainstream health systems and policies and training programs, so that services and resources are that much more welcoming, are that much more proficient at, serving their needs, right? And that much more compassionate. So that's the deal here. And I think that with that, we're ready to start these panels, right? So Jordan, stop sharing the screen. I think we're ready to do this by asking old-fashioned questions. So the presenters, the panelists here today have prepared, some statements, and I'm just going to go through some questions. We'll hear from them today. And I think we need to start out with the first question, which is, let's start from the beginning here. Health messengers, what made you decide to become a Special Olympics athlete, first and foremost? And I'd like to start this question by directing it to Alex Hanna. So Alex, would you mind sharing your thoughts?
I decided to become a Special Olympics Tennessee athlete by excelling in all the sports and activities, showing people my passion, making lots of friends, being who I am without judgment of how I compete in sports, how people look at me, or how I react to certain situations. For instance, when something bad happens, I feel worse or would react worse than other people.
All right, I'm glad that Special Olympics is that welcoming, safe space. So Haley, do you mind sharing your thoughts if your internet is working? And okay, go on, Haley.
Yes, I can. So what made me decide to become a Special Olympics Tennessee athlete is I wanted to learn more sports and I like to win and have fun with the team. I did track and field in grade school for my county, and then my high school unified volleyball team asked me to play with them, and I love volleyball.
Thanks, Haley. Sarah, you
Yeah.
mind going next?
Certainly. I decided to become a Special Olympics athlete when I was getting off my PE class in homeschool high school. Special Olympics was a fun way to try some team sports, and I really liked it. My mom said she would keep driving me so I could go. The other athletes welcomed me right away as the new athlete.
Thanks, Sarah. So Eric, last but not least.
I like it, Sarah. And I made a friend named Chandler who was a Special Olympics athlete. He told me he did swimming with Special Olympics, and that's my favorite sport. My mom helped me sign up with the Special Olympics swim team, and then I started doing other Special Olympics activities too.
Fantastic. So I am hearing that Special Olympics is a safe place, is a wonderful place to learn and grow and be with friends. Next question, you guys. How do you feel like Special Olympics is filling a gap in people's lives? For example, I know it fills gaps in healthcare with friendships with sports. Do you guys mind sharing me more thoughts about the gaps it fills? And I'd like to start this question with you, Haley, if you don't mind.
Yes. Yes, it helps people learn more sports and stay busy and make new friends.
I like making new friends too, Haley. So Alex, how about you?
Yes, and way to go, Haley. It does. I feel like it does. I feel like Special Olympics does fill the gaps in other people's lives because it allows me and the other athletes to have friendships. These Special Olympics friendships mean so much to me because everyone within Special Olympics understands what it's like to have intellectual disabilities. I also feel like there is more respect and no judgment with my friends.
Thanks for sharing that, Alex. I feel that honesty through the screen. Eric, do you mind going next?
I agree with you, Alex. And yes, Special Olympics gives people a place to try new activities, make friends, and learn ways to stay healthy.
Perfect. Sarah, last but not least.
I feel like Special Olympics lets me have a way for staying active with friends now that I have graduated high school. I like being active with sports and workouts.
Thanks so much, Sarah. So I'm hearing from everybody that friendships are the things that resonate the most at Special Olympics, and I love hearing it. So next question is, we all know that Special Olympics does sports. In fact, we do a lot of sports. But the healthy athlete's vision, hearing, mental wellness screenings that it also provides is very, very interesting. Why do you guys think it is important that athletes have access to health screenings and not only sport? So I'd like to start this round of questions with Sarah. Sarah, could you share your thoughts, please?
Oh, yes. Health screenings help someone to know if they need to get more help from a doctor. Screenings can find problems and then get help sooner for that problem. If there is a screening and an event that we can encourage each other to get it done.
I like it. I like hearing it. So Eric, would you like to go next? You're on mute. Okay, perfect.
Right, sure. Athletes need to be healthy when they participate in sports. I learned that some athletes have trouble getting high quality health care that fits their ability level. So healthy athlete screenings are very important. To help the athlete screenings help athletes learn about their health and the basic things that they need to do to be physically fit and to work on their emotional wellness.
Perfect response. So Alex, would you like to follow?
Okay. The reason why it's important is because some of the athletes don't have proper insurance, and if they don't, it will be more likely that they are not receiving any regular checkups. If an athlete does receive a checkup, sometimes it can be a challenge because some doctors do not understand how to treat people with intellectual disabilities. On a higher note, Healthy Athletes provides a safety and accepting space for athletes to get treated.
Thank you, Alex. That was a very thoughtful response you gave there. So Haley, last but not least.
Yes, athletes who don't go to the doctors might get help with hearing or vision or depression. Healthy athlete screenings are easy and accepting places to find out if you need to follow up with a doctor about a health issue.
Okay. So what I'm hearing is Healthy Athletes is a really good way to bridge some gaps for healthcare at Special Olympics. I thank you so much for sharing that with participants today, you guys. Next question for our panelists. So this one's a little bit more of a meaty one. The health disparities that people with ID are facing is frankly very surprising. Special Olympics International's prevalence report shows that on a team of 10 Special Olympics athletes, 6 are overweight or obese and are at risk for chronic conditions. 6 have problems with flexibility. 5 might have problems with strength, which places them at a higher risk for injury. 4 might have untreated tooth decay. 1 or 2 might need to go to the dentist urgently. And 2 to 3 have low bone density, even though they might look healthy. 2 never had an eye exam, right? And 4 might need new prescriptions for glasses, and then another 2 would fail a hearing test. I want to ask our panelists about their feelings about these statistics. What was most surprising to you after learning this information? How did these statistics make you feel, and why? And I'd like to start this question off with Haley. So Haley, do you mind going first?
Yes, I can. Bone density, because people look healthy on the outside, but no one knows they might be sick on the inside.
Yeah, that one's a really tricky one, Haley. Thank you for sharing that. Eric, do you mind going next?
Those stats are a problem.
Mm-hmm.
I'm surprised that so many athletes will have trouble with strength and flexibility because I really enjoy fitness workouts like weightlifting, kickboxing. I don't want athletes to get injured or not their health needs met. I want to help athletes learn about ways to stay healthy. I do know a little bit about missing eye exams though. I only found out 2 years ago that I needed glasses to see far away.
Oh, that's really interesting, Eric. Thank you so much for sharing that and disclosing that to participants today. Alex, you mind following?
I don't mind. I can go ahead. So, unfortunately, none of these things surprised me because I was aware of a lot of them. But what is surprising to me is that in 2021, we still don't have the proper resources for the athletes to make change in these statistics.
That's a really, really heavy comment, Alex. Thank you so much for sharing that. And then last but not least, Sarah.
I think my mom would like to share on this.
Absolutely. Go ahead, Crystal and Sarah's mentor.
Thank you, Aisha. As a parent, when I saw those stats, I was prompted to call the eye doctor and get an appointment for Sarah. I'd realized that I had never gotten her a full eye exam before. You know, we're blessed with the resources of employer-based insurance, so it was very quick and easy to do. As a mentor, like the other athletes have said, we're not that surprised because these are our teammates. So we kind of know what's going on in their lives and can see them. It prompts me into realizing that it's very important that everyday choices of food and exercise can have a major impact on your weight. Keeping that in control can help with a whole bunch of other health issues. Once upon a time, as a group fitness instructor, I could see firsthand working together help people meet their health goals. So seeing these stats here as a mentor, I want to extend that to help others reach.
Yeah, and thank you so much, Crystal and Sarah, the Bollinger team. You guys are amazing, and just so thankful for you being so open and honest about, these statistics and how it's really difficult, even when you're living and breathing it. All right, so with that, I'd like to go to the next question, which is for our athlete panelists. As Special Olympics health leaders, can you talk about some ways that Special Olympics Tennessee is working to improve health outcomes for people with ID, or at least we're trying to? And I'd like to start this question off with Haley. Haley, do you mind going first?
I don't mind going first. Special Olympics has healthy athlete screenings at state events. It also has the Health Messenger program, which I have trained in to become a health messenger. As a health messenger, I am very excited for health education with other athletes, families, and even with medical students to help fix health disparities issues so people can be healthy.
Thank you, Haley. And you're doing a great job of being a health messenger, I have to say. So Sarah, do you mind going next?
Alrighty. As a health messenger, I'm going to work on video cooking classes so athletes and others have some recipe and meal ideas ready to use for healthier food choices. Other health messengers will also have their own unique health projects to make healthier communities. We work together as a team to meet health goals for everyone.
Yes, I love it, Sarah. Yes. And, to that point about health messengers having their own projects, that's a really good comment because everybody's expected to do their little piece to move the needle, make these disparities even a little bit smaller. All right. So Eric, could you go next?
Thank you, Ms. Aisha. Many people don't know. I'm excited about Special Olympics Tennessee starting the Health Messenger program. I was trained as a health messenger by Special Olympics International, and then I was able to help train the first group of Special Olympics Tennessee health messengers. Special Olympics Tennessee is giving the health messengers chances like this to share important health information with athletes and other people in the community.
Thank you so much, Eric. And then Alex.
I'd be honored. So there's this one example that I decided is to provide health education for athletes, families, and other professionals. Special Olympics provides education like performance stations and family help forums so that the athletes can get the health information they need in order to be healthy.
Okay. So Special Olympics Tennessee is trying to do a few things to bridge the gap and to reduce these disparities. And I'm glad that you guys were able to explain that and share some of those, stories. So next question for our panelists is why? Why do you think health advocacy is important for the Special Olympics community? Why should we still do this work? So I'd like to start off this question with Alex. I know you went last and you're going first for this one.
Okay. So the reason why I think health advocacy is important is because a lot of athletes don't have somebody to advocate for them.
Okay. Thank you, Alex, for sharing that thought. Haley, do you mind going next?
Yes, I can. Health advocacy is important because we are talking about about athletes' bodies. Athletes need to speak up for themselves and their health. Because our independence matters, we just need to be empowered to speak up.
Yes, I think that's a very insightful and powerful comment, Haley. Thank you so much for sharing that. Sarah, do you mind going next for this one?
Okay, Ms. Aisha. Advocacy means more people will listen and begin to care about athlete interests and issues that will lead to positive action for our health.
Good one, Sarah. So Eric, would you like to go next?
Yep. And I agree with Sarah. People don't know about everything Special Olympics has, especially when it comes to health. I want athletes to be healthy and for others to learn how they can help athletes. Some athletes don't know about health advocacy, which is speaking up about your health needs and telling how you feel. I'm learning how to do that, and I like that I can teach others to do the same.
So advocacy is the process of empowering people to speak up for themselves and letting other people know that we're supposed to be giving each other space to get our messages across. I think that is a really, really wonderful kind of explanation about advocacy and why we shouldn't stop. We should still keep going, and we can do that together as a community. So the next question for our panelists, and actually this one, it looks like not everybody has a story to share. So there's one athlete in particular, Haley. I know you have something, and I really thank you for being open. This is a little bit of a, it could be an emotional question for some folks. And I'm asking if you could share a story for about a time that you received healthcare, but you did not feel comfortable or you didn't feel listened to, and you can share with folks what happened.
Yes, talking to my doctor about my depression. I've never felt like I had any privacy, and the doctor kept talking to my mom. I felt like he wasn't listening to me.
Okay. Thanks so much, Haley, for sharing that. That's a real life example of, a physician or a provider who might not have known exactly how to handle an interaction with somebody with a disability. So I appreciate you sharing that. But I think, on the flip side, there are a lot of positive experiences from our health messengers when they're interacting with healthcare providers. And actually, the next question is the inverse, which is, sharing a story about when you received healthcare and you did feel comfortable or listened to and what happened there. And I'd like to start off this question with Alex. Do you mind sharing your good story?
Is that for the seventh question?
The eighth question.
Oh, the eighth question. Okay. Yes, I can do that. I have a wonderful doctor, and she makes it comfortable for me and listens to any questions I have for her. And she listens to everything I am worried about and pays attention to all the details surrounding that.
Perfect. I'm glad that you had a really good experience. So the next question I'd like to pass on to Sarah. Sarah, do you mind going next?
Sure, Miss Agia. When I went for my checkup, my doctor asked me the question so I could answer for myself, and then asked my mom when I needed help to answer. When I was at the eye doctor recently, the staff and the doctor were nice and friendly to me and everyone.
I love that. Thank you so much, Sarah. All right, Eric, how about your good story?
My experience is just like Sarah and Alex. I have a really good doctor, and he always talks to me and asks me questions about how I'm doing. His name is Dr. Hansen.
Thanks, Eric. So I'm hearing that the difference between a really positive physician or provider interaction is you want to feel listened to. If you're not feeling listened to, that really does impact negatively on your experience. And some providers might not know, that communication is so key. All right, thanks so much to all my panelists. I think we're ready to move on to the next question, which is a little bit heavy too. And that is, do you guys think that healthcare professionals or people who are not necessarily in the Special Olympics community have an easy time understanding how to work with people with ID? And I'd like to start this question with you, Eric. Do you mind going first?
Great question, Ms. Aisha. I went in health messenger training and from some other Special Olympics athletes that some doctors have trouble. They sometimes don't talk to people with ID and only ask parents or caregivers about what's going on. I was on a panel for the American Physical Therapy Association, and I said that doctors could use things like pictures, charts, and checklists to help them tell people with ID things to do to stay healthy.
Thank you so much, Eric. And you actually gave us really concrete examples of, ways that we can learn to communicate with each other so that we're getting really creative, right? I appreciate that so much. And so Sarah, do you mind going next for this question?
Sure, Miss Agia, certainly. I don't really know because I have not asked them how they feel. I think as a professional is not sure how to work with someone, then they should ask for someone to practice with, just like I had to practice social skills with speech therapists teaching me.
Okay, wow, yes, practice makes perfect. Great comment. So Haley, do you mind going next?
Yes, I can. No, because people differences make it hard to understand what people are going through. Poor community makes it hard to understand. For example, a student in my class is hard to understand, and it's hard for people not in the Special Olympics family to figure out the best way to communicate.
Yeah, wow. I'm so sorry to hear that about the communication difficulties with your classmate. All right, Alex, do you mind going last but not least?
I'm on it. I would say no, and it's because they don't always understand what it's like to have ID. But on the occasion, someone someone that is not part of the SO family can understand.
Okay. Absolutely, I agree. So, all right, we're moving on to the next question for our panelists. Everybody's doing so great responding to these questions and laying out the real reason why it's so important to think about health in this context, to think about inclusive health specifically. Now, I'm going to be talking a little bit about, it's been a very tough year for everyone because of COVID, and especially for people with ID. I'd like to hear your thoughts about how people and athletes specifically can stay healthy and get in shape for 2021. So I'd like to start off this question with, how about Sarah? Do you want to go first?
All righty. Like all adults, we need ways to work out at least 5 days a week. In Memphis, our special director, Miss Lisa, helps us to have a workout schedule on Zoom where we are power walking for fitness. Being together helps us to remember to work out and reach our goals. Like our video walking teacher, Leslie Samson says, if you want to go far, go together.
Yeah, I think that's really perfect. You know, and I know back last year, we were probably hoping that 2021 would mean that we could, you know, get right back on track with seeing each other in person. But it seems like, you know, our life in our virtual world is, you know, is progressing. And we're just going to look forward to the next opportunities that we can get together and spend time together. But in the meantime, this is a perfect way to stay connected. So Haley, do you mind going next for this question about your thoughts on what we can do to stay healthy and in shape for 2021?
Yes, I can. To stay healthy is get back into sports and practice healthy habits lessons. It's not going to be easy getting back into shape, but with each other's support, we can achieve our goals.
Okay, wonderful, Haley. I think I have to agree with that statement too. Very much so. Alex, do you mind going next?
Definitely. So I think it would take the athletes participating in Zoom health cooking and exercise classes. And we've been doing that. We've been doing that for like several months, and I think it has made me healthier and in better shape.
I'm good. I'm so glad that those lessons are working. I love it. So Eric, your thoughts?
You're right, Alex. I think athletes have to learn how to do activity using the computer. My health messenger president is a virtual fitness club called IWEF. IWEF is short for Inclusion Revolution. I am creating workout videos that persons of all ability levels can do. It's also teaching about inclusion and inclusive health by having guest instructors and other health experts. I did my first workout video in December for a Special Olympics International 12 Days of Inclusion project. It was a great time.
Thank you, Eric. We're just going to have to keep working at it, but we fully acknowledge that 2021 was difficult for all of us, especially, you know, when we're talking about fitness and health. Let's move on to the next question, you guys. Could you tell our audience about 2 things that they could do to help Special Olympics Tennessee with its inclusive health vision? What should they be thinking about doing? And I'd like to start off this question with you, Alex, if you don't mind.
All right. I have like 2 examples, and they are, we should all work together to reduce barriers to accessing high quality and compassionate healthcare, and working together to raise awareness and funds to help support the athletes that need proper healthcare.
Okay, thank you so much. Haley, do you mind going next for this question?
Yes, doctors, nurses, and other healthcare professionals should volunteer as healthy athletes at Healthy Athletes events. And they could volunteer doing physicals and screenings at local counties events to make sure more athletes around the state have easy access to health screenings. It would also be good if doctors and nurses and healthcare people would learn more about how to care for and treat people with ID. SOTN even has lessons to help with continue professional education.
Thanks so much, Haley, for sharing that. Sarah, do you mind going next?
Sure. Number 1, communication can be hard I think healthcare professionals need to find ways to help us answer all the questions they ask. Special Olympics actually will be offering trainings on this, which me and other health messengers can help lead. Number 2, come and join us for working out someday. It can be fun to make new friends. Just make sure you register for our newsletter and follow us on social media.
Thanks so much, Sarah, for sharing those thoughts. And Eric.
Thank you, Ms. Aisha. First, since we still can't meet in person, Special Olympics Tennessee needs help getting information about health to athletes at home. Healthcare professionals could help with virtual screenings or internet-based worksheets for athletes that are interactive for alerting. Also, medical doctors can opt to do follow-up appointments with athletes if their healthy athlete screenings find something wrong.
I think that's a very insightful comment. All our health messengers, you guys have shared really, really strong, action items that we can all follow. And it starts with our communication and collaboration. So it sounds like, we all should be taking the initiative to learn more, stay up to date with Special Olympics educational opportunities and events. If you're a provider, offer yourself up to volunteer or to join in on a fitness workout or session and just, let's be friends in this. I think that is the key message, that we started out at the beginning of the session, which is people are joining and staying in Special Olympics Tennessee for the friendships, right? But we are also giving so much more in terms of the health sphere. And actually, this is a special, message to the athletes out there. Think about becoming a health messenger yourself. We have registration on our website, and then that will put you directly in line to receive training and to, take these leadership skills and this message out in your own communities. So definitely, stay in touch with us and be open to learning more. That's all we can ask. All right, so I'd like to kind of, we're powering through. I'd like to, end off the session, like the panel questions, with one question before we go into our Q&A. We have a couple questions about that. But what are you got? Just, things we can be optimistic for in 2021. What are our panelists looking forward to this year? So actually, I'd like to start off this question with you, Eric. Do you mind going first?
Thank you. I'm looking forward to swimming more. My high school swim season has started, but not my Special Olympics team. I also want to see my friends in person and go to Special Olympics competitions. I miss traveling to new places and earning medals.
Mm-hmm. Yes, I am also looking forward to, getting together finally. And, actually to just, for our participants who are joining us, we're planning a family health forum, which is actually going to outline the Special Olympics Tennessee plan for a safe return to play and activity during COVID, or during the easement of COVID, if I can say that. So yes, to be continued, Eric, definitely to be continued. All right, Sarah, what are you looking forward to this year?
Well, yes, Ms. Aisha. I am looking forward to going back to team sports someday when COVID-19 is over.
Yes, me too. All right, Haley, do you mind going next?
Yes, I can. What I'm looking forward to in 2021 is starting Special Olympics sports and events all together again.
Mm-hmm. All right, I'm seeing a trend here with all the responses for 2021, what we're looking forward to. Alex, can you wrap this all up for us?
Right away. I'm looking forward to, one, excited about getting back to in person after COVID rates gets under control. And second, this one that I made up is looking forward to seeing all of my fellow athletes and competing in sports again.
Yes, I think the competition is what we're really missing here. And I'd like to, share with participants what I am looking forward to, if I may. kind of in the same vein as, getting together, being together, seeing each other in person. I am certainly, really, really excited about the prospect of, gearing up for healthy athlete screening events. And actually, I'd like to give a shout out to 3 of our clinical directors that were able to join the call today. I know Dr. Brittany Day with our healthy hearing discipline is on. Hi, thank you so much for being here. Our Strong Minds clinical director, Carol Rabidou, she's also on the call, and our newest discipline clinical director for our special smiles, she's on, Dr. Joyce Barber. Thank you so much. I look forward to seeing you all for screenings, right? So you guys can actually do what we've set out to do, which is, help, do prevention and early detection work with our healthcare field, with our healthcare. So I think we covered the panel questions, but for registration, I know everybody's familiar with the special Q&A question, and I compiled them all on our last slide. So if Jordan, do you mind pulling them up? We'll go through them since it looks like we have plenty of time. I was worried that we might be a little bit tight, but we've made good time today. So these were all excellent panel questions, and actually, Jordan, did a few questions also come through on the chat that you've noticed?
Yes, we had one really good question from an athlete that asked, do they have to do all of the health screenings, or can they pick which ones they want to do?
You can pick which ones, that you can come to, obviously, but it's always encouraged to go to all the healthy athlete screenings that you can and that are available to you at the moment. That's a really good question, Jordan. Were there others that came through on the chat?
I didn't see any more at the moment, but I will monitor.
So I invite participants to, write your question in the chat. Jordan will, capture it and, relay them to us. But I think we can start with the very first question here, which is what to do in a pandemic. And I think that this question is pretty broad, and there are many different strategies that different people are using. And actually, maybe I could, push this over to our panelists about what they've been up to during a pandemic. So I don't know, do any of my panelists want to jump in and go first?
What about me?
Yes, Sarah, for sure.
What about me? Our Special Olympics area director makes sure we have many opportunities each week to have indoors walking fitness time. We watch together on Zoom while doing a power walk video series called Walk at Home. This is good cardio exercise. At the end of each meeting, we remind each other of COVID safety, wash the hands, wear the mask, and stand 6 feet away.
Wow. Okay. Yes, that's wonderful. Love those. And Haley, I saw that you raised your hand. Do you want to go next?
No, I didn't raise my hand.
Oh, you didn't? Okay. No problem, Haley. I'm sorry I called you out then. But even from Sarah's response, I'm hearing we're doing virtual. Like we've transitioned to virtual world. We're learning, in a virtual environment, but we're also using the tools that we're learning to be safer. So the washing the hands, the masking, and the social distancing, that's all that we've learned, throughout the past year. And actually for this question, I know that Eric, you got a shout out or a specific question about what you've been up to, how your workout has changed since COVID, because you haven't been able to swim consistently or as consistently. Do you care sharing your thoughts?
Sure, Ms. Aisha. Well, my workouts now are mainly virtual. I work out online with my trainer on Sundays and with my Special Olympics team most days. Also, my high school swim team and my competitive swim club have started, so I'm back in the water almost every day. I love that.
Thank you so much for sharing that, Eric. I know we don't have all the answers about what we do during a pandemic, but we are doing our best to make Zoom, to make virtual work in the meantime until we get to that magical day where we can all practice and be together. The next question is also an excellent question: is any progress on Down syndrome and Alzheimer's research? This one, actually, I want to kind of notify participants on this call that there's going to be a webinar that's hosted by the Down Syndrome Association of Middle Tennessee later in March. And actually, the title of that webinar is Risks of Alzheimer's Disease in Adults with Down Syndrome, an Introduction to the Research Studies. I think that that would be a really, really good webinar for everybody to jump in on if this is something that they want to learn more about, specific research, and the research questions which go around this. So I'm going to ask Jordan to link up the registration link in our chat. So if you're interested, definitely go ahead and well, actually, Jordan, don't link it now. We can link it after the slide. So look out in the chat box.
I'm sorry, we just had a great question come through the chat box.
Okay.
I didn't know if you wanted that now.
Oh, does it relate to the research?
No, it does not.
Okay,
I just feel like it's a really good question that could be answered by the panel.
Oh yeah, sure. Why don't you read out that question then, Amy, since you're at it?
It says, sometimes at home, I don't feel hungry. What should I do?
Ooh, that's a very good question. So actually, Haley, is your hand raised for that?
Yes, it is. So what you can do if you are at home and you feel and you're not that hungry is what I typically like to do is work out. And if like I work out and everything, it makes me feel hungry. And then after I work out, I go eat and then I can rest. So just working out, I think, will help you want to not feel hungry.
Okay, thank you. That was a really, really good comment, Haley. And I don't think I could have answered it better than you did. So that's a trick. That's a tool. Definitely, use really creative ways to, fit in some really healthy foods in your diet. So, all right, that's a good response. Actually, I couldn't have said it better myself. And actually, I think I saw a comment from Alex. Alex, do you want to, have a go at the first question? Was what we do during a pandemic?
Yes.
You can go ahead and do that.
Yes. So, what you can do like during the pandemic is like you could like do some exercising. Like you could do some exercising, like, and eat some healthy snacks or whatnot. Or you could play a dancing game as for exercising.
Okay, I like it too. And I love dancing. And I know Alex has a really, really cool pair of dancing shoes that you used to dance with. And I'm very impressed, always.
Ooh, you got cool dancing shoes?
Well, was that you, Alex, that has the shoes that light up?
Oh, yes, that was me.
Mm-hmm. Yes, so you see, I remember.
LED shoes. I got those today.
All right, well, thank you so much, Alex, for answering that question. And the next one is, the third question: when do you recommend individuals and families begin the process of transitioning from pediatric to adult healthcare? I think that's an excellent question. It's a hard one to answer, though. And that's just because there's really just no hard and fast number for when that transition should occur. And you, families, caregivers, you should all be, invited to have those, start those conversations with your care teams and your providers to see when that is appropriate for you and your family. But yeah, I hope that.
Sorry, there was a caveat that came through the chat box on that, and wasn't sure if someone could possibly understand that question 3. You're right; there's no hard or fast timeline on it, but wondered if there's anybody that could offer any insight to what parts are easier on that transition and what parts are harder, so they're just aware of it.
Sorry, Amy, can you come again with that question? I don't. Amy?
Mute, Amy.
Are you there? Can you hear me now?
Yes, I can hear.
Okay, so in relation to question number 3, understanding that we don't have like an actual timetable on that, but for those that have gone through the transition from pediatric to adult healthcare, can you guys offer any insight on, is there any part of that transition that was hard or any part of that transition that was easy?
All right. So actually, I think this question would be best answered by potentially the mentors of our health messenger teams. So any mentors would like to take on that question that came in from Amy about what makes it what makes this process easier for transitioning.
If not, Aisha, I can address that.
Sure. Thank you, Joe.
Being a parent of a 37-year-old, when we went through the transition, and I will caveat that with saying, like, I'll reinforce what Aisha said, it is a personal decision to make between you and your caregivers or medical team. But when we transitioned with Matthew, the hardest part was leaving our pediatric doctor because we had been with him for 18 years. And then transitioning into a new healthcare provider that we really didn't know a whole lot about. And one of the most difficult parts was being on TennCare and having to follow the policies and recommendations that TennCare assigned you a primary care doctor. So the easiest part for us was leaving the TennCare recommended primary care doctor and going to our family PC, who is now Matthew's primary care doctor. But there's pros and cons of each side. I do think parents of younger individuals, it can be traumatic leaving a medical professional that you've been with for a certain number of years and then transitioning into a whole new medical care team. So to me, that is the most difficult part.
Yeah, well, thank you so much, Joe, for sharing kind of that personal insight. And I know this question is actually a pretty challenging one to address, just because a lot of providers out there are more familiar with disability as it pertains to young people and children. That's just the nature of how the medical education is going right now. Adult kind of practices. It's just the familiarity isn't always there. So that's why it's not kind of a matter of identifying an age and then making that transition. It's a conversation. It's a lot of research. It's a lot of hard work. And actually, I think I saw a resource guide that came in from the chat, and I really appreciate that coming through. I love the engagement and the resource sharing that happens in our communities. And I think that these tools are kind of like the first step in starting or kickstarting that process of thinking through how that could look like for you and your family. All right, but very excellent question. All right, so this next one is also a challenging one, and is how you can best find inclusive health providers. I know our community is really, because ideally every provider is an inclusive health provider, but I think that naturally or practically that's not always the case. But maybe our health messenger mentors have some insights on how they've addressed this problem and this question. So I don't know. From the Bollinger team, Crystal, Sarah's mentor, do you have thoughts on what you could share?
Yes, for us, it was word of mouth from other people within the disability community.
Mm-hmm. Okay.
I mean, it would be interesting if there were some way to include that find a provider on your insurance thing that, specialty or welcoming or some kind of icon to click on, but it was word of mouth.
I think that can resonate with a lot of people on this call too, because it's just there's no document which directs everyone to, oh, this provider is going to be inclusive, is going to be very well versed or well practiced in treating diverse populations and populations with ID specifically. But just to share with everyone, our goal here at Special Olympics Tennessee is to really grow and strengthen that, that education that is available to providers so that they are providing the highest quality, the most compassionate care they can for members of this community. And that can happen in a variety of different ways. Continuing education, obviously, volunteerism through healthy athletes, that's a possibility. But it's just, making sure that we're growing growing the number of providers who are able to do this work with their patients. Yes, Amy, I see that you have your
Sorry,
hand.
because this is another question that came in through the chat box that didn't know if our healthcare providers that are on here, that might be a good thing for they can answer. So we have Lana from New Mexico Healthy Athletes. They want to know, how do you let the doctors know about an ID, and how can we let them know what to look for?
Mm-hmm.
So I think it's like opposite. How do we educate the healthcare providers? And Lana, is that, or Leanna, I hope I'm pronouncing that right. I hope I'm getting your answer. I hope I am asking your question appropriately. So I guess it's on the flip side. How do we educate the doctors, and what do we tell them to look for?
Okay. So I love that question, because this is really, well, we try to kind of do education through healthy athletes, obviously, but that's not necessarily how most providers learn about how to engage, patient populations with ID. And I don't know, I think you're right to kind of, maybe ask the clinical directors who are able to join the call. I know that one of them did log off, but either Carol or Dr. Barber, do you have thoughts about how we can do that education, how providers can do work better? Yeah, maybe it's unfair for me to just, call them out right now, but. Hi, Carol.
Aisha, this is Carol Rabideau. There's the health kit that trains people in the medical profession, especially doctors, how to work with people who have disabilities. And I know there are occasionally trainings that doctors can join if they would like to do that, or they can just access the health kit online if people would like to pass that on to their own doctors.
Yeah, and actually I just saw on the chat the IDD toolkit that Carol is referencing. Yes, that is a really, really great tool, especially for Tennessee, to do that online education. I know I did it for not the provider side, but for the caregiver side, and it was just really a lot of good, informative kind of tools that we can use to just work better, to treat better, and to engage better with this population. But sorry, go ahead.
I'm sorry, but anybody can access that from any state also. So it's not Tennessee specific.
Perfect. Yes, thanks for that clarification, Carol. I hope that answers that question a little bit more. I think it's a really good one though, because our program is really trying to find ways to kind of bring that toolkit, like bring more awareness towards it, and make sure that we're connecting our physicians across the state with that tool, and maybe offering more, so that there's just, I feel like giving people more options is just going to mean that more people are going to be able to engage at their comfort level. So that's what we're trying to do. All right. So I think if we go on to, I think we're good to go on to the next question, which is at what age should young people start learning about health? I love this question. And actually, if I could, if any of the health mentors, the health messenger mentors would like to share their thoughts about this one, because you guys are living, breathing, you guys are working with athletes and young people about this all the time.
I will, Aisha.
Thanks,
I think it's very important for them to learn right away. I think more we can teach them at a young age, it's going to help them as they grow.
Okay. Actually, we can stop sharing the screen, Jordan, so we can see each other's faces for this one. I like this. I like that response, Lisa. And actually, I am going to just offer out to folks that the younger, the better on this one. It's just, the real kind of pathways to education is doing age appropriate education. So, you know, a 5-year-old is not going to be processing or, you know, really understanding at the same level as a 15-year-old. Obviously, it's making sure that, you know, they're learning at their pace, at their age group, which is what is most appropriate. And sometimes that education just looks like good health, like good role modeling, right? So it's modeling, you know, good, healthy snacking habits. It's modeling healthy, you know, exercise. And then having those conversations can, you know, can grow with their ability as they age. So any other health messenger mentors want to jump in with their thoughts about this one? No? Any other questions which are coming in through the chat?
We have one last question, Aisha.
Yes.
An athlete asked, can my mom stay with me at Healthy Athletes?
Absolutely. Your mentor, your parent, you know, anybody can go through screenings with you and be your support person. We encourage it. Okay. Any other questions which are coming through on the chat, Jordan? Okay, perfect. So I'm so glad that we were able to get through this program. In fact, we are ending a little bit earlier, so I'm giving, you know, time back to our wonderful participants who spent, so much time with us today, learning more about, you know, our inclusive health initiatives and our programming, and hearing from our health messengers themselves about ways that they are working towards that goal and ways that they are inviting you all to join us in this work. So, we have lots of programming in store, and it's not only for health, it's also, we have programming for fitness, we have programming for our Unified Champion schools, and also for young athletes, which is, you know, athletes on our younger age brackets. And you can get all that information by, you know, signing up for our e-newsletters, by checking our website. And I know Jordan's going to be linking a few resources in the chat, so keep a lookout for those as well. And, you know, just stay in touch, reach out if you have ideas or questions about how we can move together towards this mission and then towards this work. And, just thank you so much to everyone for joining us here today.
Before we jump off.
Oh yes, Amy, go ahead.
I ask if you want to, I don't want to peer pressure anyone, but I would love to get a group shot of all these amazing faces. So if you wouldn't mind showing those faces for us.
Yes, I would like that too. Thank you for jumping in and reminding people, asking people to turn on their cameras if you want to, right?
Give a big smile, a big wave, whatever you guys want to do.
All right, health messengers, strike a pose.
Wait, hold on, coming back. Wait. Don't leave that pose. Stay with that pose. I liked it. Okay, one more time. 1, 2, 3. Awesome. You guys rock.
Well, I don't have any words left to say. I'm just so appreciative to everybody in this community. And I know we're going to rock it with, you know, doing a more inclusive health programming. So keep a lookout for all this information. Yes, go ahead.
I'm just going to poke my head in a little bit. This is Eric's mentor, and I am a mental health professional. So just want to make sure that we're highlighting Special Olympics is also doing Strong Minds, making sure we're letting our athletes know that part of health is their mental health, and we're going to look out for their emotional wellness as well. So make sure you're looking for those Strong Mind resources as well.
Oh, yes. And actually, I'm glad you mentioned that, because our Strong Minds clinical director, Cal Rabideau, is working with her team at Vanderbilt to creating a toolkit for the Special Olympics community as a whole. So that should be coming through your networks and channels as well. We'd be happy to share that.
That's excellent. I'm glad to hear that.
Yes, absolutely. I'm geeking out for this. All right, everyone. I'm gonna say that this is a wrap. Health messengers, you guys did great. Thank you so much for sharing your thoughts. And thank you to all the participants here today who are motivated and compelled to do this work and working towards inclusion. So shout out to everybody. All right. Bye, everyone.
Thank you.
Until next
Bye.
time.
Great job. Thank you,
Thanks,
everyone.
everybody. Great job.
Bye.
Thank you.